بسم الله الرحمن الرحيم. طبيعي كنت أتمنى إنه يكون محاضراتنا interactive عنا في مستشفى الشفاء، لكن شاءت الأقدار إن نبعث لكم المحاضرات بهذه الطريقة. للضرورة أحكام. أنا دكتور إياد الروبي، Urology Consultant, Head of Urology Department in Al-Shifa Hospital. I am the Program Director of Urology Training Program. I am the Chairman of Scientific Committee of Urology in Palestinian Medical Council. طبيعي أنا من الأطباء اللي رجعوا من قطر. I got a Board of Urology, RCS, Membership of Royal College of Surgeons, and the 2 fellowships, one in endourology and the other one in voiding dysfunction and urodynamics. We'll start this lecture. طبيعي إن شاء الله you will enjoy the urology section or rotation, let me say, لأنه urology you will face urology cases whenever you will go after finishing from or graduating from faculty of medicine. You will need urology. طبيعي urology dealing with urogenital system in male and urinary system in females. The genital system for females is belong to gynecology. If we'll start with urology symptoms, like in all other sections in medicine, you will start with history, then physical examination, lab investigation, and if you need imaging to reach the right diagnosis. In urology, in history taking, we'll start with chief complaint, history of the present illnesses, patient past medical history and surgical history, family history. The most common complaints that the patient can come in urology is the pain. What other things? Changes in the habit of micturition, changes in the appearance of the urine color, change of the function of the urinary tract or the genitalia, and systemic symptoms. If we'll go through these one by one, why urology patient can get pain? Because of the obstruction. Where we can find obstruction? We can find the obstruction in the ureter. Obstructing stone, ureteric stones can cause obstruction. Urinary retention. Sorry for the interruption. Also, we can get obstruction in the cases of urinary retention, especially in acute urinary retention, as over distension of the bladder can cause severe pain. Urinary bladder, I mean. Why we can get pain in urology? Because of the inflammation. Where we have parenchyma in our urology, or urinary tract, or urinary system, let's say, we find this parenchyma in the kidneys, in the prostate, and then the testes. An inflammation in these areas can cause severe pain. Usually, the inflammation of the urinary tract not causing severe pain, mostly can cause discomfort other than the pain. Tumors also can cause pain if it can cause some kind of obstruction or invasion to the nerves. The site usually costovertebral angle. If you can differentiate between colicky pain and dull ache pain, usually if the pain is due to obstruction, it will be colicky in nature. If it is due to inflammation, it will be dull ache pain. I will skip this slide. Differential diagnosis, as you can see, you know all of these. Urethral pain distribution is very important also. If the patient has upper ureteric stone, the pain may be referred to scrotum in the male and the labia in the female. If it is in the mid-ureter, it will distribute to or refer to right lower quadrant, that it can mimic the appendicitis in some cases if it is in the right side. Lower ureteral obstruction can be, these patients usually are coming with voiding symptoms other than the pain. Voiding symptoms, mainly it will be irritative voiding symptoms in the form of urgency, frequency, and nocturia. Vesical and prostatic pain, as just before moments I told, usually the pain in the urinary tract will be in the form of constant pain, discomfort other than colic in nature. Prostatic pain due to over the edema, which can cause distension of the prostatic tissue inside the capsule, can also cause pain. Penile pain, the pain in the flaccid penis usually can be due to urethral urethritis other than other causes. In the erected penis, it will be due to Peyronie's disease or priapism. In the lectures of the andrology section or andrology, which belong to andrology section, you will discuss these, me or my friend. Scrotal pain also, it is in the scrotum. We can put it into two categories, either acute or chronic pain. Acute scrotal pain, usually the most common two differential diagnosis is epidermolysis or torsion. For this reason, please, in any time you can, if you have a patient with acute scrotal pain, exclude first the presence of torsion, because if you will miss this diagnosis, the patient can miss his testis within 5-6 hours. Chronic scrotal pain, usually due to hydrocele or varicocele. Scrotal pain also can be due to referred pain. Also, between your mind, some patients can come with scrotal pain, and if you examine the scrotum, you will not find anything. If you do detailed workup, you can find upper ureteric stone, that, as I mentioned before moments, that we can go refer pain to the scrotum or to the labia, as I mentioned. We have in urology also lower urinary tract symptoms. We told this is LUTS as abbreviation, LUTS, lower urinary tract symptoms. We can put the LUTS into two categories. One will be obstructive LUTS or obstructive symptoms, and the other one will be irritative. Obstructive symptoms or obstructive LUTS will be weak stream, intermittency, voiding by straining, sense of incomplete emptying, and dribbling. The irritative symptoms is 3: urgency, frequency, and nocturia. And please, whenever you will talk about nocturia, you will mention how many times per night the patient is passing urine. Okay. Frequency, if we'll start these one by one. Frequency, normal other person will pass around 6 to 8 times per day. In each time, the capacity will be around 300 ml. If this patient can pass more than this, this is frequency. Nocturia, as I told you beforehand, that the normal person must not void during sleep. Before, in the text boxes, they used to tell that the normal person is the normal person can pass up to one time. Now, in the last meetings which we attended abroad, the experts telling the normal person must not pass any time. As I told you, you mentioned the number of the times that patient is passing, are passing. You need to differentiate in the nocturia, between nocturia and nocturnal polyuria, or especially in some patients with heart failure, and peripheral edema. Dysuria is not from these category, but it is painful micturition. Let's mention it in this side of the lecture. Urgency, as I told you, it is sudden, intense desire for urinate or to void. Hesitancy, delayed starting of urination. Weak stream, as I mentioned, it is also from the LUTS, lower urinary tract symptoms, and obstructive LUTS. Voiding with the straining, as I told you, using abdominal wall muscles to expel the urine outside. Intermittency, as I told you, it is interrupted voiding or stream, post-void dribbling or terminally dribbling. Another symptom in urology is the incontinence. We have many different types of incontinence. We have continuous incontinence, especially if the patient is young or child. You will think about congenital anomalies like ectopic insertion of the ureter, more distal to the straight sphincter. In all people, usually it can be after uterine surgery, gynecologic surgeries, in the cases of vesicovaginal fistulas, post-radiation, post-obstructive or obstetric trauma. Stress incontinence, sudden leakage of urination with increased intra-abdominal pressure, with coughing, sneezing, or exercises. Usually this kind of stress incontinence can be found in the females after multiparity, after multiple deliveries, as in females, female patients or female persons, depending incontinent mechanism. Very important part of to get or to be continent is the strong pelvic floor muscle or muscles. Why? Because the urethra is short, 4 centimeter, not like in male. The intrinsic sphincter, I mean the bladder neck, which is involuntary sphincter, is weaker than that in the male, and no prostate, as you know, in females. And the straight sphincter, which is in the mid third of the urethra, also is weaker than that in male. For this reason, females is depending on strong pelvic floor muscles, which we called hammock effect. Hammock effect, the urethra is sitting on fixed or in very strong base, that when the patient will sneeze, cough, it will be fixed, not mobile, like hammock يعني الأرجوحة. After multiple deliveries, the pelvic floor will be loose, that this urethra will be not fixed, and it will lose the support from down. That patient, whenever will cough, the urethra will move. We call this in urology urethral hypermobility. To finish this the etiology I mean of the stress incontinence. Usually we have two etiology of stress incontinence, either intrinsic sphincter deficiency or urethral hypermobility. طبيعي الانترنسك sphincter deficiency usually it will be more obvious in the old age group or in diabetic patients. Urgent continence, which is loss of urine which is preceded by a sense of urgency to urinate or to void. طبيعي ممكن في the other lectures will go for the details. The etiology it can be because of urinary tract infection, that it can cause urgency and urgent continence, and the cases of cystitis, and in the top or in the end of the last, which is more complicated etiology, which is neurogenic bladder, overactive bladder. We'll talk about these later on. Overflow incontinence. Overflow incontinence, I want you to think about 1 cup of water. When you start to fill it, after being full, the others will come out, or the rest of the water, the extra water will come out. This is exactly the overflow incontinence. This kind of incontinence you need to put in your differentials, especially in old age group, because these age group, mainly in the males, large prostate or benign prostatic hyperplasia can make obstruction that after sometimes patient will have chronic urinary retention, and he can get overflow incontinence, or after long period of intravesical obstruction, the patient bladder can be flaccid, underactive, that it will be like a sac. It will be full of urine, and the rest of the capacity, the rest of urine which was extra to the capacity, will come out. This is overflow incontinence, and just you can diagnose this kind of incontinence by doing bladder scan or ultrasound, that you will find the bladder is severely full of urine. Enuresis, passing urine during sleeping, and it is normal up to 3 years of age, and we are not interfering up to 5 to 6 years old. We are not treating these children. Other symptom in urology, hematuria, the presence of red blood cells in the urine, or blood in the urine. We can put it into 2 categories also. Microscopic hematuria just can be found in the lab when you are doing microscopic examination of the urine, that it will show microscopic some red blood cells. Or gross hematuria, that patient can come with that he is able to see the urine, the blood in the urine, or the color of the urine will be reddish. We have painful hematuria. Painful hematuria usually due to infection, but painless hematuria, this is very serious. Please put in your mind that any patient can come to you, especially old aged patients. It is malignancy till proven otherwise. You need to take it seriously. Also, according to the timing of hematuria, if it is initial, terminal, or total hematuria. Initial hematuria usually it is originating from the urethra. Total hematuria it is from the kidneys, bladder, and terminal hematuria usually it is coming from the bladder neck or the prostate. As I told you, you will ask about the pain and if it is associated with clots or not, because what's the meaning that there is clots? clots showing you that it is severe, the severity of the hematuria. The shape of clots, is it important? Yes, it is important, because if it is thread-like hematuria, that means it is coming from the kidneys, from the ureter, from the nephrons. Change, as I told, change in the gross appearance of the urine, cloudy urine, and biuria, in the presence of the white blood cell in the urine. Phosphaturia also can cause cloudy urine. What's about the abnormal appearance and function of the male external genitalia? Male sexual dysfunction, as I told you, you will have one lecture, andrology lecture, that will present all these details for you. But impotence, as you know, inability to achieve and maintain erection that it will be adequate for intercourse. Other male disorders or sexual disorders like libido, absence of emission, absence of orgasm, premature ejaculation, and later on we'll go through all these terminologies. Hematospermia also is very common problem or presenting symptom for some patients. Also usually it is non-specific, but also most of the time we need to do detailed workup to rule out for example malignancies. Penile complaints, cutaneous lesions, penile curvatures, urethral discharges in the cases of gonorrhea and chlamydia, scrotal complaints. Patients also can come with cutaneous lesions like sebaceous cyst or other lesions in the like lipomas. Yes. Absence or retractile testes, especially in pediatrics, you can find retractile patients can come, or families can bring their children complaining of the empty scrotum, and it can be either undescended testis or retractile testis. The difference between these, I believe, undescended testis is not coming down, it will be up, superior to the external inguinal ring in the inguinal canal or in the abdomen, but retractile testis, it will come down to the scrotal cavity or the scrotum on and off. Scrotal swellings and masses. Patients can also come with fever and chills, systemic symptoms, especially in the cases, as I just told you, we have parenchyma and 3 organs in urology: the kidneys, prostate, and then the testes. If you will get a patient with an inflammatory process in these organs, these patients can come with high-grade fevers, 38, 39, 40. But usually if urinary tract infection, it will be low-grade fever, less than 38. You can differentiate between these two differentials from the fever itself. Other symptoms like fever, like weight loss, especially in chronic diseases, you can find this some systemic symptoms. The examination also, like in any other subspecialty or departments, you will start with inspection, looking for the place or the organ or the site. Then you will get vital signs before that. Then as it is written here, signs of dehydration, like a dry mouth, This is all with the inspection you can get it, and then you will do as I told you, go to the detailed physical examination. I just told you to start with the inspection, scars, distension of the prominent veins. I will not go through these because you experience all of these in general surgery. Palpation also, it is like in other departments or subspecialties. You will use warm hands. You will examine non-tender area or the other side first. Light palpation, then deep palpation, guarding rigidity, rebound. Also, again, I know all of you, mashallah, you know these things very well. Palpation of the kidney, also you can do bimanual examination of the kidneys, like you can see in this slides. If the patient is obese or will be obese, usually you will not be able to palpate the kidneys, but in thin patients, most of the time you can really easily you can appreciate the kidney if it is swollen. For example, in the cases of biliary tract junction obstruction or nephritis, in these cases really you can find or palpate the kidneys easily. According to the, if we'll go one by one, abdomen examination, you will look for the tenderness. Bladder palpation, you can also feel, you can appreciate it with the inspection actually, the distended bladder, but also you can palpate it and you find it is there. Percussion also, you will confirm your suspicion of retention. Auscultation, usually in urology you are using in the to hear the bruit in the renal arteries. Penile examination, also the prepuce in the cases of phimosis, paraphimosis and hypospadias. Also will go through these in the genitalia abnormalities or in the other lecture. Phimosis is contracting of the prepuce that it can't come backward, and sometimes the orifice or the meatus or the opening of the prepuce will be very tight that it will not be able or allow the urine to come out. Paraphimosis, as you know, it is retracting the prepuce to the level to the corona, and it will cause stasis in the venous system, edema of the glands that it will not come further, and this is very common in uncircumcised people, in non-Muslims. Hypospadias, opening of the urinary meatus, not in place in the ventral aspect of the penis. It can be glandular, penile or penoscrotal. Also we'll discuss these later on. Examination of the scrotum, also the inspection, palpation, you will palpate the testis, epididymis and the vas. You can, I know very well that you can differentiate between the scrotal swelling, which is originating from the testis itself, or it is coming from up. If you will come above it, it is belong to the scrotum or the testis. If not, it is hernia. Yes, we discussed this also. Differential diagnosis in the scrotal swelling. If it is solid, non-translucent, it is testicular tumor. If cystic and transilluminating or translucent, this is hydrocele. According to the If it is separate from the testis, if it is solid, it is epididymitis. If it is cystic in nature, it is epididymal cyst or spermatocele, we call it. To complete the systemic examination, it is very crucial and very important to do digital rectal examination. Digital rectal examination, you will evaluate the anal tone. Why? What is the benefit of that? Because it will give you an idea about the neurologic condition of this patient. If you will palpate the prostate, you will have an idea about the prostatic size, consistency, prostatic medial sulcus, lateral ferrous, tenderness, if it is tender or not in the cases of prostatitis, and if there is any other anal pathologies. If we can find asymmetry, hard, firm prostate, duals, this will give you the suspicion of tumors. By manual examination, especially in the bladder tumors, it is also very important. In females, we can do digital rectal examination with putting another hand on the lower abdomen, and we have our own classification for these to measure the invasiveness of the tumor. In the female, we can do PV or put through the vagina and palpate the mass. Thank you for listening to this lecture.